At least 50% of patients with chronic conditions don't adhere to their treatment. When people don't follow their medical plans, it leads to worse health outcomes and higher medical costs. One of the most common reasons that people don't follow treatment is due to lack of knowledge. Only 53% of adults have intermediate health literacy, meaning that they can understand medical information. Because of this lack of understanding for almost half of adults, doctors need to make the effort to educate their clients. One way they can do this is by providing patient education materials, such as handouts or videos. But how do they know the best formats to use? Hi everyone, I'm Matt from eTactics, and today I'm going to share tips for choosing the best forms of patient education materials. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. This shouldn't come as a surprise, but everyone learns differently. Knowing the different ways that people learn is the first step to deciding which education materials to use. There are 4 different types of learning through our senses. They include visual, auditory, reading or writing, and kinesthetic. For the most part, these are self-explanatory. Visual refers to when people learn through what they see. They understand information best when it's in graphic format such as charts, diagrams, or symbols. Auditory learners process material easiest when they hear it vocally, such as through discussions and reading aloud to themselves. People who learn through reading and writing understand information in the form of handouts or presentations. And kinesthetic is a fancy way of saying hands-on learning. These people use a more active approach in education and use all of their senses. As a health professional, knowing these different methods will help you narrow down the kind of materials to provide. This could be YouTube videos, handouts, demonstrations, podcasts, and webinars, just to name a few of them. You can determine what will work for people based on their learning styles. For instance, a pediatric patient who can't read yet wouldn't learn through reading and writing. Someone with poor eyesight would also struggle to read a comprehensive handout that you give them. And older adults with difficulty hearing won't benefit from listening to podcasts. Without knowing the best method, you'll end up wasting your time by making materials that aren't useful for teaching your patients. If it's harder to determine the learning method for some people, you can ask them what they prefer. Learning style is just one way to narrow down which kind of materials to use. Demographics such as age, income, or location can also contribute to the most efficient way. For example, different generations prefer different platforms. Younger groups are more digitally oriented since they grew up with mobile devices. Because of this reason, they're more likely to appreciate education materials in digital formats. If they can access them from anywhere, there's a higher chance that they'll use them. Considering access to materials is another important part of choosing the best format. If you're going to offer digital methods, make sure your clients can obtain them. Lower income groups have limited access to online options. More than 1 in 6 people in poverty don't have access to the internet at all. There are even more limitations for those in non-metropolitan areas. People in rural communities could have trouble obtaining other formats of learning, such as group classes. No matter what format you choose for your patient education materials, be sure to consider if it's suitable for your client demographic. Non-adherence continues to be a problem in the health industry because so many people lack health literacy. When they don't understand how to make decisions or follow their medical plan, they're less likely to adhere. Since doctors know that a lack of understanding is a cause for this, they can prevent it with better education materials. And the first step is knowing how patients learn best. This helps when deciding what format of materials to provide, and defining the audience and their needs makes it easier when starting to create educational content. If you'd like to learn more about patient education materials, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.